Hi, it's Adrian Katz from Advanced Dental Artistry here in West Perth. I want to talk you through an all-on-4 case where we're replacing an upper full denture and lower failed implants. Emeric first came to see us actually in 2013 and then he came back for treatment actually in 2015. So 2013 when we first saw him, basically presented with a full upper denture. You can see that it's starting to chip on the upper left hand side. He's got a standalone tooth, his last tooth on the lower right, which is a canine tooth. And the rest of the teeth is actually, he's got 4 implants that are actually failing on the lower jaw. Full upper denture is actually quite a big denture, so we know he's lost a lot of gum and a lot of bone. When we see that the pink plastic is very thick, we know that the pink is actually replacing the gum and the bone. And this thickness actually means that there has been a lot of resorption or a lot of shrinkage from his mouth. One of the problems with implants is that you need to place implants with adequate space between them for the bone and also for the patient to be able to clean. When we actually have implants that are too close, what happens is the bone tends to die between the implants, and when that happens, of course, then the patients will lose implants over time. So this was 4 implants actually placed, and the bridge was being held in by the 4 implants, but you can definitely see the build-up of plaque and tartar around these implants, and that's caused failure. You can also see the lone standing tooth there. With his upper denture in place, this is how his bite's actually looking. And as I mentioned before, the denture is quite a thick denture, so it's very heavy and it's starting to drop and fall. Diagnostics were done by Patrick and I, and our role was really to plan the case together to get the best outcome for both the aesthetics and of course the bite. That's Emeric taking out his denture there. And you can see the change of his face when he's not wearing dentures. What we actually do is we do a digital smile design, and this is really important to make sure that the treatment we do is in harmony with the face. We look at certain lines on the face and we plan the treatment so that we ensure that we're looking at the face and the harmony of the face to set the teeth in the right position. This is a smile before treatment. You can see one of the things with the Emeric smile is that it's actually inverted. The back teeth are actually lower than the front teeth, and of course it should be the other way around. A smile should normally follow the lower lip, and that nice smile curve that we talk about is when the front teeth are actually longer than the back teeth, and this is what we call an inverted smile. In a video you can definitely see this. This is Emeric counting, and we use video a lot to plan the case because that allows us to see how a patient's lips function, but also to check things like phonetics. This is actually Patrick. He's actually talking to Emeric. He's asking things like, what colour teeth would you like? What shape teeth would you like? The idea is to always cater for the individual, and everyone has a certain way that they should look. We want to make sure that each case is individually designed for the patient. What actually happens after that is Patrick will set everything up on a model, and this model is to really give the patient an idea of what the final result's actually going to look like. In Emeric's case, we can fit the final upper denture and we can use the bottom to ensure that the bite's going to be correct. And that's a close-up of the new trial denture with also a trial partial denture, just to ensure that we're getting the bite and the appearance of the teeth correct. This is a very difficult case because we are replacing top and bottom, and there's been so much change in the patient's mouth, so we want to make sure that this is correct. So that's actually viewed now just with the trial denture in, and we're going to use that trial denture to set up the all-on-4. Again, this is me just checking the position of the teeth. You can see still the old teeth down the bottom, but you can see now he's got the new denture in place, and we're using this denture as a template for the all-on-4 treatment. Treatment day, we've got our on-site anaesthetist to put the patient to sleep, and that's the safest way to conduct treatment. Our patient goes to sleep to get this treatment done. Treatment would normally take us to around about 3 to 4 hours. Do a try-in day, which is basically a few days after, so it's usually a day or 2 days after having surgery done, and this is the lower. And this is the teeth actually held in wax. So at the moment, basically we've just got the teeth actually held in wax. This is a video that's taken just 2 days after treatment. You can actually see in the after video that definitely Emeric's puffy because he's just had surgery, but you can definitely see the difference in his face now. The height has changed in his face, the position of his teeth have changed, and you can actually see that in the after photo, his smile line actually follows his mouth correctly. And here we have some close-up images actually of Emeric before in 2013, and of course just 2 days after surgery in 2015, you can definitely see the change in his smile and the change in the height of the teeth and the position of the teeth. So let's look at Emeric now. We'll just see this video of him. Again, you can see the image on the right hand side of him smiling, but you can definitely see the change here now on the left hand side. If you have any questions, you can contact us at 1-800-SMILING and book your complimentary visit, or you can email me direct at dradrian@adaperth.com.au. I look forward to seeing you in the practice.